Now, besides this, I have already put up the bacteriology video of the images and all, and I have put up the parasitology video also. And if you able to give up your 2 hours, 1.5 hour, you're able to cover up the full microbiology beautifully. Okay. Besides that, certain questions which can which I think will be definitely you will be seeing up there in the exam. So that particular questions see guys, definitely there will be a question regarding meningococci case study. They will give you regarding the fever, headache, neck rigidity, Karnick sign, Rudzinski sign, and then they can give up that CSF has been taken up, cultured on chocolate agar and all. And organism found to be catalase and oxidase positive. Okay, and Thea Martin media that is there used for them. Catalase oxidase positive. This meningo and it is lens shape. This is one is lens shape, and they can show you that purpura fulminans also here, and endotoxic shock is common here because this is gram negative one having this lipooligosaccharide which is responsible for the endotoxic shock. Then guys, that particular thing C5 to C9 complement deficiency leads to what recurrent disease infections, and which is the very serious affair here. The serious affair is Waterhouse filtration syndrome. So all that is very important, which you need to focus upon. So meningo is a must know. Besides that, gono is a must know, and in the gono they will give sexual history and all, and then they can give arthritis history also. Polyarthritis is observed in this particular one, that after a sexual encounter somebody have developed up some certain episode urethritis, and after that he ignored up all that and later on develops the joint pains and all. Which particular thing? Reactive arthritis it is. So you have to focus upon this gono. Okay. Besides that, regarding gono also having the same media Thea Martin, and neocagar is a special media used with gono itself. Okay, so that is also to be remembered here. And drug of choice for this is ceftriaxone. That is no doubt about that. And for the meningo, you will prefer to use firstly penicillin and later on ceftriaxone. So that is also sorted. Okay, so these two are damn sure questions. Besides that, the damn sure question is regarding the diphtheria. Okay, regarding the diphtheria, there is a damn sure question, and they can give a pseudomembrane or they can give a cuneiform arrangement, Albert staining and all. Okay, and they can ask regarding the culture medias, LSS or potassium tellurite agar. Okay, so these particular things they can also ask that retrograde also they can ask. They can give you this particular picture of the culture media and they can ask which organism grows up, or they can give you a history that is case like study that a particular child is there, unimmunized one, comes to you with pseudomembrane and all. Okay, and develops bull's neck and all. There is a neck edema which is observed up. Okay, so all those particular stuffs you need to focus upon. And in the Corynebacterium, one question which I'm remembering is Corynebacterium minutissimum that leads to erythrasma. That also needs to focus upon. Then another hot favorite case study which can come here is regarding the sort of a zoonosis, that is the Bacillus anthracis. And Bacillus anthracis, you already know that guys, that leads to what? That leads to malignant pustule. There is a cutaneous anthrax and the pulmonary anthrax, Wool-Sorter's disease in which the pneumonia happens, mediastinal hemorrhagic necrosis. And besides that, in the malignant pustule, the black eschar, that is you need to focus upon the black eschar. And whenever this black eschar comes now, you now need to think for three things. That is for this cutaneous anthrax stuff. Okay, cutaneous anthrax stuff. One is regarding that rickettsial family members disease, that is the scrub typhus. Can you tell me scrub typhus is done by what, guys? Onisha susukhamusi. And nowadays, if the black eschar is being observed up or black crust is being observed up, you should think for mucor also. And that's why the name, which is wrongly being said, black fungus. Okay, so black fungus is mucor, white fungus is candida, and the yellow fungus is the mucor stuff only. That is less known ones, mucor septicus. Okay, and as such, if you say now that aspergillus is also having a lot of yellow color, and there is number of demitaceous fungus which are yellow in color. So you can't depict up that which is yellow. So this nomenclature itself is wrong. That is yellow fungus, black fungus, and white fungus. These all nomenclature itself is wrong. Okay, so this is a must study: meningo, gono, diphtheria, and Bacillus anthracis and all. Besides that, what else you can remember up here, guys? So besides this particular ones, you can think of like a case study of Mycobacterium tuberculosis. Definitely the question can come regarding it. And the other hot favorites are atypical mycobacteria, which can be asked up in the exam. Runion's classification. Okay, they can show you that which mimics what and that. So need to focus upon that also. Mycobacterium leprae, that is causing the leprosy, and they can ask up the regarding treatment and all that. So we have discussed already in the video. Okay, besides that, in the case of E. coli, diarrhegenic E. coli is a must know. Okay, diarrhegenic E. coli is a must know, and the hot favorite of diarrhegenic E. coli also in that is this EHEC, antrohemorrhagic E. coli. Which one? O157H7, which is grown up on which particular media? SMAC. Why? Because it does not ferment sorbitol. So it is grown up on sorbitol mekong agar. So that is also a must know. Besides that, you know that which resembles Shigella, shigellosis, invasive disease, enteroinvasive E. coli, enteropathogenic E. coli leads to pediatric age group diarrhea, and A/E lesions are observed in this. Okay, and ETEC you already know that is enterotoxigenic E. coli that leads to the traveler's diarrhea. This is the most common cause of it. But enteroaggregative E. coli also does the traveler's diarrhea. So that also needs to focus upon. It leads to neonatal meningitis because of the K1 antigen. That also is one of the questions. And UTI you already know. Okay. And if somebody asks you that what are the preliminary tests for the UTI stuff? So preliminary test for the UTI stuff which you need to know is definitely not the culture. The culture is not a screening test. Grease nitrite test, catalase test. These all are the like screening test for the urine. Okay, you can go for the nitrate reduction also. That is also screening, but culture is not screening. Remember this. Okay, and which type of urine should be taken? Midstream urine sample. Midstream urine sample. Another hot favorite question which can come regarding Haemophilus influenzae. Haemophilus influenzae, they can ask you regarding the satellitism and all. Okay, satellitism, it does show. It was used to be a common cause of meningitis and all, but now it is not so. Okay, Haemophilus influenzae can be asked. It's a gram-negative cocobacilli, which is catalase and oxidase, both positive. An important one which we had just now studied is meningo and gono, which are catalase and oxidase positive. Okay, this is also catalase and oxidase positive. Grown on the, it loves to grow on the chocolate agar and all. Another media, Leventhal fieldase agar, that is being used for this to grow up the Haemophilus influenzae. Haemophilus egypticus is there, that is termed as Koch Weeks bacillus, which leads to this pink eyes and all. And guys, you know about them, the Hackett group members. The Hackett group members leads to what? Culture negative endocarditis. And besides that, very important aspect to cover up is regarding the infective endocarditis stuff. They can ask you regarding the infective endocarditis stuff. Duke's criteria. How many blood cultures? 3 blood cultures you have to take up for diagnosis infective endocarditis. Okay, 2 sets. They say the 2 sets means aerobic and anaerobic one. And that you already know that native valve endocarditis is done by staff, and that is early onset, late onset. So that I have already discussed up, but that is a must know, which you need to focus upon. And in the case of strepto, you need to focus upon the acute rheumatic fever, acute glomerulonephritis. They can be asked in the form of history, in the case of case history. Fine. So that we have already discussed up. And then they can focus upon some skin lesions like impetigo, okay, or some pus and all. That is there. Okay, necrotizing fasciitis, that is flesh-eating bacteria and all, erysipelas and all, they all are done by this staph and strepto both, but mainly the impetigo and necrotizing fasciitis mainly associates with streptococcus pyogenes. GBS, you know, GBS is like the most common cause of neonatal meningitis, associates with what? That is early neonatal meningitis. Early and late both are there. And besides that, you know that it is a normal flora also, and it gives this CAM test positive. What is CAM? Christie-Atkins Much-Peterson. Okay, Christie-Atkins Much-Peterson. And Clostridium perfringens, you can prefer up a case history. And what case history can Clostridium perfringens can come? That is gas gangrene stuff. They can give you a particular road accident history, and they can give you the structure that it looks like a brick shape, and they can be gram-positive one. So this is observed in that. So it causes gas gangrene, that you also know, Clostridium perfringens. Besides that, Clostridium tetani can be in the form of the case form that somebody have got injury from rusted iron or get into the soil and all. What is the mechanism of action of this tetanus toxin? Presynaptic inhibition, you know that. Presynaptic inhibition of glycine and GABA. Besides that, there might be a history of those botulism stuff. Okay, there might be a history of what? Botulism. Infant botulism happens due to just honey ingestion and all. So that is also important to know. Regarding the CDAD, Clostridium difficile associated diarrhea. What is the drug of choice nowadays? Vancomycin, not the metronidazole. Okay, which investigation you will do? You go for this toxin demonstration. That is the ANB, anterior plus cyto. Culture is best, but they're difficult to culture, Clostridium difficile and all. Okay, which particular antibiotics does it? That is third generation cephalosporins, it does it. Okay, so that is also an important entity to be remembered of. Then in the bacteriology, the things which you can focus upon is regarding the Legionella BCYE agar, that is important, leads to atypical pneumonia, leads to pontine fever, that is important. Zoonosis, guys, definitely zoonotic disease can be asked, and zoonotic disease like brucella, that is brucellosis, they can give you a history of a farmer or a person contact with a dairy farm worker, okay, which the animals, that particular fellow is a constant touch, develop some skeletal features also. Important is skeletal abnormalities are common in the case of brucellosis, high grade fever, Malta fever, undulent fever, okay, which comes and goes. There is down and again it goes, high grade fever happens. Okay, Tbilisi phage typing, those particular tests you need to focus upon. Drug of choice is doxy. So doxycycline is drug of choice. Doxycycline is in fact drug of choice for all the rickettsial members. Script typhus, that is OXK positive. Okay, another zoonotic stuff which you need to focus upon is leptospirosis. Okay, leptospirosis, which is a spirochete. Okay, leptospira is a spirochete, leptospira interrogans. If they give a history of something like hemorrhagic features along with the jaundice or conjunctival suffusion and all that stuff, they are talking about leptospirosis. Which serological test in here, guys? That is the microscopic agglutination test, MAT. SAT is done for brucella. SAT is done for brucella, and CAT is done for mycoplasma. And that their FMG question for CAT was which is the most common cause of atypical pneumonia? Answer is mycoplasma pneumonia. Which particular media used for that? PPL agar. Okay, and which just told now that OXK is for what? Script typhus, Orange Tsutsugamusi. And here also in this particular history you can get up in the question the blackish car, that is chigorosis stuff. So you can need to focus on that. Other than that, Bartonella, you can do Bartonella quintana, Bartonella Hansley. Okay,